All right, today's topic, or today's focus, is going to be on the executive branch of Wisconsin's government, specifically the role of Wisconsin's governor and how the office shapes women's lives. As it's an especially important topic as we prepare to cast our ballots next week on Tuesday, August 11th. So I'm going to say make sure you get yourself to the polls, and if you can, someone else too. To help contextualize this for us, we're joined by Maura Flaherty, who has served as Chief Legal Counsel for the Wisconsin Department of Health Services since 2003, which works to protect and promote public health, manage healthcare programs, and regulate care facilities and for people living in Wisconsin. It's a principal administrative agency within the executive branch state government, and we are so happy you can be with us.
Really happy to be here, truly. Thank you. I'm going to share my screen. I have some very basic slides I'd love to share with you all as we go. So everybody knows the three branches of government. I think, though, especially having joined the executive branch some years ago, that the executive branch is arguably the least well understood. I think there's a lot we see in great detail about what the legislative branch is doing. We see the judicial branch, but the executive, there's a little bit that goes on. There's a lot that's going on behind the scenes that people kind of have broad strokes knowledge of, but I think is worth diving a little deeper today and talking about because it really impacts our state. So we'll do a quick shout out. Not just to the governor, but to the other executive branch elected officials. So big ones here, the Attorney General, who leads the Wisconsin Department of Justice. I'll talk a little bit more about that if we have time at the end. The Lieutenant Governor, Secretary of State, State Treasurer, and then in Wisconsin, our Department of Public Instruction, DPI, is headed by a separately elected official. We're not going to focus too much on these other folks today. We're going to focus on the governor and the governor's authority and control. So a couple things that people automatically or tend to immediately know about governor authority will be the veto power and the budget. But let's talk a little bit more about the budget and what that process actually looks like. That is something I personally did not know until I joined the Department of Health Services in 2023. And I think it's relevant. I think it's valuable to understand it a little bit better. So you probably know we have in the state a biennial budget. So it starts July 1st of odd numbered years. So our current budget is July 2025 through the end of June 27. The first step in creating a budget is the executive branch preparation. And we are actually at DHS going through the budget prep right now for the 2027 start budget time. So like later today, I have a session where people in the different aspects of our agency are presenting what will ultimately be a package that we as the department present to the governor. So what we're doing in the agencies are both identifying our costs to continue, as well as new ideas or ways to improve. And we put a lot of time and effort and strategy into all of that. So we have budget and policy analysts who will analyze those costs to continue. So keep doing what you're doing. How much is that actually going to cost you? And so we are the agency, for example, that runs Medicaid. You can imagine that is actually a very complex calculation. It's really complex going into the next budget, given all of the changes the One Big Beautiful Bill Act pushed forward last summer. It's changing a lot of administration of the Medicaid program, and that's really going to affect that budget. But we also propose ideas. And so I'll just zoom in on my department because it's the one I know best. But we do a lot of different things in addition to Medicaid and food share and WIC. We also do a lot of the mental and behavioral health services that the state runs. We run 7 inpatient facilities across the state. We regulate healthcare entities like hospitals and nursing homes. And so when we're thinking cost to continue, how much do we need to pay the surveyors who go into hospitals and nursing homes and other entities to make sure we're still doing that same amount of work? How much do we need to keep our 7 facilities running as they are? But then we have this opportunity in each different category to propose ideas and things that we think would be valuable to the state of Wisconsin. And so the example I'll run through in the process here is postpartum Medicaid coverage. So DHS has been putting postpartum Medicaid coverage expansion from 60 days of Medicaid coverage after birth to some longer period of time. We are really excited that ultimately this year in 2026, we moved it from 60 days post-birth to a year post-birth, that birthing mothers will be able to have a year of coverage after they've given birth. But that has been part of Governor Evers' budget since his very first budget. It's been in the DHS budget proposals every single time. And so we prepare these budget, we have our grand ideas. We try to think about, this is the ideal, this is what we're shooting for. What would that actually look like in practice, and put these packages together. And we work collaboratively then with the governor's office to present our ideas. And ultimately that results, that whole process, in a package that the governor presents to the legislature. At that point, the legislature will take time to consider the budget bill. And the agencies all will have their own session in front of the Joint Committee on Finance. So DHS will go and present all of our ideas. And it's not just like the idea, but truly, how will we implement? What does that actually look like in practice? What are the numbers? And what's the research to support it? So we're really helping the governor to advocate for the policy positions that he's advancing in the budget. And obviously there's quite the legislative process that we won't have time to dive into, but focusing on the executive, once there is a budget bill, the governor has partial veto authority. And actually the partial veto authority, you've surely heard about in the news. It's made some splashes the way Governor Evers has used it, but the partial veto authority is actually in the Wisconsin state constitution. And it is a little bit unique. Other states don't have that exact language. And so kind of a cool Wisconsin governor fact. And so once the budget goes through the governor's partial veto, the legislature could override. If they get 2/3 of the vote in each house, they could override the veto, which we haven't seen happening. But I think that the postpartum Medicaid coverage is a great example of sort of the effort through the budget that the state executive branch can try to make. So in addition to obviously putting it in every one of his 4 budgets, Governor Evers also would repeatedly go to lawmakers, putting in major addresses over the 8 years to push for this postpartum coverage. And we too at the agency have been advocating to the legislators for years to explain this is, by the time early 2026 came around, it was just Wisconsin and Arkansas who had not extended postpartum Medicaid coverage. And so we were truly knocking on doors to say we need to do this, and this is valuable for the people of Wisconsin. So that budget process is really critical, and I think it is an important part of the governor's work, but obviously it's a really hand-in-hand process with the legislature. So it's not as if obviously the governor can put all their ideas into the budget and just get them through. Like with postpartum coverage, every budget has included some version, even shorter versions than the 1 year, and it has not gotten through the legislature. So there is definitely a need to find negotiation, and that also will depend on what the political winds are at the time of the budget. Talk about the cabinet appointments. So I put this overwhelming slide together because I think it's actually important to see how many agencies the governor appoints the head of each of these agencies. So for most of these, it's a secretary. Um, I think personally that one of the most important jobs of the governor is identifying talented people, leaders who can lead these large organizations. So for DHS, ourselves, have nearly 7,000 employees who work for the department. We run 7 inpatient facilities. We run Medicaid and food share. We set the vaccine schedules for the states. We regulate all of these entities. There is so much truly day-to-day work occurring at just that one agency, and you can imagine at the others as well. And so having the ability to appoint those leaders to set the policy priorities at each of these agencies is really critical. And then where somebody like me comes in, the secretaries get to appoint their major positions within their agency. So chief legal counsels are appointed by the secretary. The deputy secretary and assistant deputy secretary, so those are sort of the 2s and the 3s at each agency, are going to be appointed by the secretary. And then for us, the Medicaid director, for example, is a political appointment. The communications director is a political appointment. So you're really shaping the leadership of each of these agencies as the governor. And then we work collaboratively with the governor's office. I will, an hour from now, I'll be on with the chief legal for Governor Evers, just touching base on routine stuff. We meet multiple times a week, and they do that with all of the agencies. They're really involved in the day-to-day operations, and there are different degrees of day-to-day operations. They're certainly just focusing on like the higher level decisions or issues, but I think this is the piece that I feel like people kind of know but don't really always see. And there are so many ways that these agencies can impact people's lives. And it kind of loops back to that first slide, which is like the executive, what does it mean to execute the law? What power or authority do you really have? If the legislature is actually just writing the law, you're just executing it. So I want to launch into that a little bit and talk about rulemaking first. So we have the legislature writing statutes. We all know that. But the agencies get to write administrative rules. And so you may hear reference to that. This is one I think is worth kind of a deeper dive to say, what is that really? What is the scope of that authority? So I've made up a little pretend agency so we can just really keep it very simple. So let's say the statutory language is the Department of Fun shall issue an exciting toy to every child under the age of 12 in the state each year. So as the department, you get that statutory language, but it's really up to the agency and its authority to say, what does that really mean? So in an administrative rule, you might need to define what is an exciting toy. You know that it, what does that mean? Let's put some definition around that. How do you know, like, is it if a child is 12 by the beginning of the year, or if the child turns 12 during that year? How do you determine if a child is 12? How do you identify the children? You might create a process for that. You might create a timeline for toy issuance or a process by which it goes. So the administrative rule is really to flesh out the details, the operational details of the statutory language. But the Department of Fun cannot go beyond what the statute allows. So, for example, we identify that children really need food right now. We just don't have the authority to expand the administrative rule to say, like, also let's give the kid an option to pick food instead of the exciting toy. That's just beyond what the statute allows. If we said we really think there's like a lot of interest from older kids in getting an exciting toy, the department cannot independently, without a statutory change, go ahead and expand access to 15-year-old kids. So how does that actually work in a real life example? I want to talk about breast pumps, everyone's favorite topic. So the Affordable Care Act does require health insurance plans to cover breastfeeding equipment. And that must include a breast pump. But there's no specificity in the law about whether it's a rental unit or a purchase unit, if it's manual or electric. And so in the 2010s, Wisconsin Medicaid coverage and most insurers in the state required a member to have delivered a baby, to provide documentation to indicate that they have the potential for adequate milk, they have a long-term need for and a planned use of the breast pump. So 2022 comes around, we're in the Evers administration, and Medicaid announces an updated breast pump policy. It allows for 3 breast pumps per member, no prior authorization needed, manual or electric, purchase or rental. So that removed the requirement to show potential for adequate milk and long-term need. And that really significantly opened up access to breast pumps in the state. And then in 2024, we further expanded coverage by allowing providers to prescribe breast pumps anytime after the member's 3rd trimester of pregnancy. So the other kind of what I feel like is a fun fact about Medicaid. Medicaid is one of the largest insurers in the state. And at the time that we made these changes, the other insurers in the state were not covering that. But Medicaid, most insurers want to be doing at least what Medicaid is doing. They feel like it creates a floor. And so since these changes, the other state insurers have made those changes to their insurance policies in the state. And so those are ways you feel like, okay, that you're restricted with the statutory language, but there are so many little ways that we are able to make beneficiaries' lives better, for example, in the Medicaid program. And there is a lot of room for interpretation, whether to throw up barriers to, for example, women's health concerns, or to try to remove those barriers. And having a governor who's appointing the secretary and the leadership of the department to set all of those decisions. I mean, all of that I just described took a lot of work. And logistics and pushing to make sure that these things happened. They were not like the easy route to just continue, but identifying the need, prioritizing women's needs, like it's critically important. So we only have a couple minutes left. I want to talk about litigation a little bit. So you see these headlines: Wisconsin joins lawsuit. Wisconsin joins states suing to block termination, and then Evers suing. So what does it mean for the state of Wisconsin to sue? We've had a lot of litigation where we've challenged the federal government in the past year and a half, work I am personally very proud of. But when you see that Wisconsin joining the suit, you're really underlying that is going to be a collaboration between the Attorney General's office and the Gov's office and its agencies. So this Wisconsin joining the suit against USDA to force food share funds. As the food share agency in the state, we were critically involved in that. So every declaration that went to the court on behalf of Wisconsin, all the kind of like knowledge about what is going on and what the issues are, what the agreements say between the feds and the state, all of that stuff is coming from the agencies and is a real coordination between Evers administration and Wisconsin DOJ. And so I think we've been really proud of that collaboration between those two major executives in the state in sort of standing up to some of the Trump administration policies that we disagree with. The SNAP litigation was a perfect example of how, when people are talking through the governor's race and stuff about getting things done, what does that really mean? Why does that feel like such a headline in a governor's race. I do think that SNAP litigation is a good example. So we're in late October, and USDA is saying it's not going to issue November benefits because of the government shutdown. Along with other states, we decided to sue. And we were in front of various courts. It's now early November. People are without their benefits. The feds are saying we're not going to push these benefits out. And you all probably saw like that Wisconsin was the first state to get SNAP benefits out. And that was a true collaboration with our Medicaid director, who is brilliant, with the legal team, with Governor Evers' team, and Wisconsin DOJ to say when there's a federal court that held that the benefits must be issued. We had truly all these ducks in a row to get the benefits issued immediately. And so it's both like the policy desire and priorities, but also just operational leadership to have everything ready to go. We knew that we'd probably see or potentially see an appeal of that federal court decision. But while it was not appealed, not challenged, or not held by a circuit court, we were able to push those benefits out. Something I'm really proud of. And like I said, I could talk for another hour about this topic. I think it's really interesting what the ways the agencies impact the people of Wisconsin, but I think we are about at time. So I will pass the mic back to Lisa.
Can I know we don't ever do this, Lisa, but I'm going to ask Maura to clarify one thing because we had a previous Civic Break on the postpartum care expansion bill. And
Yeah.
so I just want to be clear that in the upcoming budget, even though Governor Evers has had that as a budget line item for years and years, like this year, they're sort of hemmed into approving it in the budget. Is that right? Or
Yeah. Well, so this year, you mean the next biennial budget?
correct?
Yeah,
Or what you're making proposals for now?
we would treat that as cost to continue as opposed to a new item. Yeah. So we're very excited about that one. Very proud of that work.
Did that answer your question, Alexandria? You good?
Oh, 100%. Yeah.
Okay, perfect. Well, thank you, Maura. That was a nice, quick, deep dive on the executive branch. I think each of us maybe took an extra nugget from your presentation. So thanks so much for sharing all your insights and helping us make sense of the governor's branch. If nothing, or the executive branch, if nothing else, it maybe created a little more curiosity and inspired us to dig a little deeper on our own. So thank you so much for coming today and being a part of this Civic Break. Out of tradition, I will just remind everyone that the Women's Fund is conducting laundry nights the last Monday of every month, and we typically use laundry night as an informal way to have further conversation on the Civic Break topic. So, Maura, consider this your official invitation to join us on Monday, August 31st for laundry night. Kosana, our vice chair of our board, is hosting at Blackbird Bar on KK in the Bayview neighborhood. So you're certainly welcome. We'll be there from 7 to 9. We are also going to the movies for Cinematic Sisterhood on Monday, August 17th. So if you're looking to see the movie about horse girls, please join us. We'll be at the Oriental on Monday night. And you may have heard we're having a Women's Fund Her Scholarship reception on Thursday, August 27th. And to extend the conversation today, we heard a little bit about the Department of Health and Human Services. On August 27th at the Her Scholarship, we have added a layer of interest. We have invited the Secretary of the Department of Financial Institutions, Secretary Wendy Bauman. She was with us for our National Women's History Month reception in 2025. And so she was brand new in her role at that time. And we are now inviting her back for a bit of an update and to hear more specifically about what she and her department are doing for the financial well-being of women in Wisconsin. So it's a really nice expansion of this role of the executive branch, since that department is also part of the executive branch. So that's exciting. If you haven't gotten your invite or want to know more details, please let me know. With that, I think I can officially end the recording. Thank you so much again for being with us. We will be sending out a survey tomorrow.